Good afternoon. I'm happy to be talking about a new treatment for patients who have methamphetamine dependence, addiction, abuse, whatever. And it's exciting because it's really the first treatment we've ever had for methamphetamines that's been shown to work in clinical trials. I was at the American Society of Addiction Medicine conference this last weekend, and they presented a paper which actually came out in the literature late last year, showing this study where they took patients who had methamphetamine dependence problems, and they gave them a combination of two drugs, Vivitrol, or long-acting naltrexone, that of course we use all the time for our alcohol patients and our opioid patients. It blocks the opioid receptors in the brain, and we've had great success with it, and it really works well to decrease cravings and with opioids to prevent relapse. And no one really thought it should work for methamphetamines because that works through a slightly different part of the brain, more through the dopamine system. But they found that when they combined that with Wellbutrin or bupropion, then it worked well as a synergistic or a combination thing. And in some ways it's not too surprising because Wellbutrin or bupropion has been shown to help with nicotine dependence, helping patients quit smoking. And a drug called Contrave came out a few years ago to help patients with food addiction, with food dependency, obesity, by using both oral naltrexone and that drug plus the bupropion. It seemed to both work together in the brain, to stabilize the receptors and help decrease cravings. So now that's a new treatment for methamphetamines, and one of the things that came out in the conference was just how serious the methamphetamine problem has become. There's actually the second leading cause of death and overdose from methamphetamines now, even though fentanyl, of course, is still number one. It's a growing problem, and we're starting to see more of it here on the East Coast, and so it's nice to know that there is some treatment for it.